The Model Systems Knowledge Translation Center presents Spasticity and Traumatic Brain Injury. This slideshow is based on research conducted by the Traumatic Brain Injury Model Systems Centers program and serves as a resource for individuals with traumatic brain injury and their supporters. The Model Systems Knowledge Translation Center is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research. This resource summarizes research on how to manage spasticity or muscle tightening after brain injury. Spasticity is common in persons with severe brain injuries. People with spasticity may feel as if their muscles have contracted and will not relax or stretch. They may also feel muscle weakness, loss of the fine motor control, for example, being unable to pick up small objects, and overactive reflexes. Some things you need to know are: many people with TBI do not have spasticity or have easily controlled spasticity. Your brain injury may cause the muscles in your body to become stiff, overactive, and difficult to stretch. The muscle may spasm or tighten suddenly. Doctors call this effect spasticity. Spasticity may not be bothersome and does not always need treatment. Spasticity may come and go. It may be worse during certain activities, or it may become worse at night. It can interfere with sleep or limit the ability to function. When problems such as these arise, there is need to consider treating it. Severe spasticity may cause almost continuous spasms and can cause permanent shortening of muscles, making even simple movements difficult. There are ways to treat spasticity or relax muscles, ranging from controlling triggers to taking medicines. When only a few muscles are affected, focal treatments such as nerve blocks and botulinum toxin injections may be considered. There may also be surgery options. Your brain communicates through your spinal cord and nerves to your muscles and causes them to contract and relax. After brain injury, the messages between brain and muscles may become unregulated, leading to unwanted muscle contractions. The symptoms and degree of spasticity are different in each person and can include sudden involuntary tightening or relaxing of a limb, or jerking of muscles in the trunk, the chest, the back, and abdomen, hyperactive or overactive reflexes, such as a muscle spasm when the arm or leg is lightly touched, stiff or tight muscles at rest so that it is difficult to relax or stretch. This is more pronounced than the normal muscle tightness seen when a person sits for a long period of time. In spasticity, the tightness is so high that it is difficult to stand or walk. Muscle tightness during activity makes it difficult to control movement. Spasticity can happen at any time, but it is most likely to occur when you stretch or move an arm or a leg, have a urinary tract infection or a full bladder, have constipation or large hemorrhoids, have an injury to the muscles, tendons, or bones, including bone fractures, wear tight clothing or wraps, feel emotional stress, or have any kind of skin irritation, which includes rubbing, chafing, a rash, ingrown toenails, or a skin sensation that is too hot, too cold, or causes pain. This also includes pressure sores or ulcers caused by staying in one position for too long. Spasticity is not always harmful or bothersome and does not always need to be treated. Sometimes, however, there are problems caused by spasticity that can be bothersome or harmful. Problems caused by spasticity include pain when muscles tighten, limited motion, especially in joints that can limit walking or moving in and out of beds or chairs, difficulty taking deep breaths, falls, poor positioning in a chair, wheelchair, or bed, poor sleep and tiredness during the day, skin pressure ulcers, difficulty maintaining proper hygiene, limits on normal activities such as feeding or grooming, limited use of the hands. Urinary tract infections and skin breakdown can be avoided by keeping skin clean, wearing loose clothing, and changing positions regularly. Taking extra care when moving from a chair or bed can also help keep triggers from occurring. Other triggers, such as constipation or large hemorrhoids, can be avoided by eating a high-fiber diet and drinking plenty of water. Even though stretching can sometimes be a trigger of spasticity, daily, consistent stretching can actually help you maintain flexibility. Sometimes, wearing splints can help keep spasticity from becoming worse. The following treatments will help to maintain flexibility and therefore reduce spasticity and the risk for permanent joint contracture. Regular stretching or range of motion exercises will help maintain flexibility and temporarily reduce muscle tightness and mild to moderate spasticity. Standing with support, often with the help of braces, will help stretch muscles. Splints, braces, or progressive casting into the desired position provides continuous muscle stretching that helps to maintain flexibility. Ideally, it is a position that does not trigger your spasticity. Careful use of cold packs or stretching and exercise in a pool may help. It is important to get the advice of a physician or therapist on what physical treatments are correct and safe. Medicine may help control spasticity, but may have side effects, and is probably most useful when you have spasticity in several parts of your body. Common side effects, such as sleepiness, might be more intense after a brain injury. You should discuss the benefits and side effects of various medicines with a physician. Appropriate medications may include Baclofen or Lurosol, dantrolene or Dantrium, tizanidine or Zanaflex, and benzodiazepines such as diazepam or Valium or clonazepam or Klonopin. Focal interventions are treatments that involve injections into the muscles and nerves to reduce unwanted muscle hyperactivity to control spasticity in local areas. These injections rarely cause widespread side effects and do not affect the brain or spinal cord. The benefits of the injections are temporary, so they must be repeated several times a year. These injections require regular stretching to be most effective. These injections might include the use of botulinum toxin or phenol. Injections can be used safely in combination with other spasticity management. Baclofen is the most commonly used medication for spasticity. Intrathecal baclofen pumps are small hockey puck-sized devices that release tiny amounts of baclofen into the space around the spinal column. Intrathecal baclofen pumps can be especially helpful after a traumatic brain injury. A surgery is performed to implant a small battery-powered computer and pump, usually in the patient's abdomen. Intrathecal baclofen can be used along with other spasticity treatments. Like other treatments, this pump can reduce the frequency and intensity of spasms. It has the advantage of maximizing the beneficial effects of baclofen with fewer side effects than taking baclofen by mouth. The pump is replaced every 6 years. For additional resources on traumatic brain injury, please visit the Model Systems Knowledge Translation Center website at www.mskTC.org. www.msktc.org.